Hi, I'm Dr. Mark Zala.
Hi, I'm Dr. Elliot Campbell.
We're here in our new Mohs Surgery Center, and we're excited to answer some of the most common questions you might have about Mohs surgery.
Mohs surgery is a very precise way of removing a skin cancer while getting the highest cure rate and taking as little skin as possible. We're able to do this because in real time we check the edges under the microscope before we sew up the wound.
Mohs actually refers to Fred Mohs, who was a general surgeon in the 1930s and originally developed the technique. Now it's become the gold standard for treatment of higher risk skin cancers.
The most common types of skin cancer that we use Mohs for is basal cell and squamous cell, but both Dr. Mark and I also perform Mohs for melanoma, predominantly on the head and neck.
While not every skin cancer requires Mohs, we usually use it for cancers which are in cosmetically important areas, especially the head and neck, as Dr. Campbell mentioned, but also cancers which are large for their location, cancers which are poorly defined and we can't see where they start and stop, cancers that may have recurred after some previous treatment, or some cancers which are aggressive under the microscope.
While fellowship training is not required, both Dr. Mark and I completed our fellowship at Mayo Clinic and are board certified in Mohs surgery.
One of the questions we commonly get is whether Mohs surgery hurts. We don't want it to hurt, but this procedure is done just with local anesthetic. We don't have to put people to sleep. On the other hand, there are multiple techniques we can use to make the injections more comfortable. And for people who are severely anxious, we do have some medication we can use to calm their nerves if necessary.
Mohs surgery is an outpatient procedure, and it's performed up in our Mohs Surgery Center, which is on the second floor of our practice. We recently designed this space with your comfort in mind.
One question we often get is how long it takes. While the removal of the cancer is very quick, there is then some waiting time while we check the edges under the microscope. Most often we do some repair afterward, and on average I would say it takes about 3 hours altogether. Occasionally less, sometimes more.
Not all Mohs surgery requires stitches. Some wounds heal better on their own, but in most cases it does help with the healing process when we repair them. We can discuss this on the day of your surgery.
Anytime we cut the skin, there is some sort of a scar. The advantage of Mohs surgery is we keep the wound smaller, so the scars are smaller. All wounds mature over about 6 months. Our goal is that by 6 months, those wounds are blending nicely and hard to see. In the occasional instance where someone has a scar that's more noticeable than desired, we have a number of options to address those when needed.
While there are many ways to treat skin cancer, Mohs surgery is the gold standard. If your dermatologist recommends Mohs surgery, we can discuss this with you, along with any other options that may be appropriate on the day of your visit.
We hope this video has been able to answer some questions for you about Mohs surgery. If you have a cancer in need of surgery or wish to schedule a consultation for an additional opinion, please feel free to give us a call.